family members.
Right. We would teach them about the different complications.
Okay.
And tell them to be prepared, because there are sickle cell disease can affect from the top of your head till your feet. So 10% of children with sickle cell disease would have a stroke.
So what's the mortality rate, or is there, how
So
does this,
the thing is, we've had, in the 90s and in the early 2000s, we found out that if you did a particular test to measure the blood flow in the brain, it's a non-invasive test. It's just like, like an echo, like you do an ultrasound.
Right.
You could measure the blood flow in the brain and detect those kids who are at higher risk for having a stroke. So we've reduced the number of children who can have a stroke because of it. But the only way to stop them from having a stroke is to transfuse them with
my
blood.
word.
So there are very few patients with sickle cell disease who have never had a blood transfusion, because most of them have had a blood transfusion sometime in their life. So they can have a stroke, and sometimes they can even have a stroke and you don't know it. We call it a silent stroke.
And they estimated about 8,000 to 10,000 people back then having sickle cell
not
disease.
that many.
Not in New York
Yeah,
State, but
not that-
overall in the whole country, it's about 100,000.
100,000. So New York State of individuals diagnosed with sickle cell. But the thing is that the cost of those diagnosed with sickle cell is higher for sickle cell than it is for pretty much even AIDS. It's like $15,000 per person, for treatment.
Why is that?
Because of the repetitive hospitalizations.
I see.
Right? You have a lot who use the emergency room. That becomes their first point of
But
treatment.
you're in a crisis situation.
Well, you do go to the emergency.
You really need the emergency room.
Yes.
Right.
But what happens sometimes, like Dr. Baptiste talked about the life expectancy today being in the 20s, early 30s, because a lot of people...
40s, in the
20s, in the 20s.
Well, it's really in the 40s, I
Yeah,
would
it
say.
is in the
Right.
40s.
There is a peak in the 20s.
But a lot of them...
But we're
when
losing
they
a lot of
lose,
young
we
ones.
lose a lot
Yes,
of young ones like
Yes,
this.
yeah, and that's because of, in transitioning from pediatric into adult care, it's somehow they just get lost to care. I guess as
What did you say? They get
lost to care.
Okay. All
Meaning there's no follow-up.
No
with their-
continuity for
no
them.
continuity with their hematologist.
No insurance sometimes.
And
good
sometimes
grief,
it's
right,
insurance
insurance.
issues. Right, because, they're off their parents' insurance.
Right,
And
right.
if they don't have a job where they're covered, then they're lost to care. Now, we know that some do get Medicaid, right? And this is where now with the New York State Medicaid, it will show you that sickle cell is one of the highest,
Costliest disease.
the costliest.
Right,
That's the
right.
word. Costliest for Medicaid.
Now, there is a bill. If you could talk to us about what this bill is on sickle cell.
Okay.
Is it called the Sickle Cell Bill?
Yes.
That we have introduced.
That has been lingering in the House, the
Assembly
legislature
and
for like 7 years.
Oh, good grief.
Yeah.
All right. What can we do to make that change? Come on.
But
now. Right.
the bill really it's about sickle cell treatment, right? I think Assemblywoman Alicia Hyman is the one that's sponsoring it in the Assembly, and James, don't remember his name now.
That's all right.
For
Right.
the Senate.
Our viewers will search for it.
But the bill, the focus of the bill is really to get funds for sickle cell care in New York State. New York State, as we mentioned before, has the highest individuals diagnosed with sickle cell, and they get the least amount of money compared to states like North Carolina that gets somewhat of $4 million, and they have way less population than New York State, and Pennsylvania that have way less population than New York State, they get $2 million. Last year, I think there was only $170,000 that was allocated
That's just
for sickle cell.
nowhere near enough, right?
That's like a
that's
drop
like
in the
nothing. That's
bucket.
nothing, right?
That's really nothing.
Right.
Back in the early 200s, like the late 1990s into 200, we were getting 500,000. Yep. But even that has dwindled down to.
Well, and the cost of care has increased.
Is
so it's
increasing.
just, right. So it's not keeping
So
up.
it's not really keeping up with what is needed for the population. Now, in terms of finding individuals that are lost to care, you have to hire individuals to do that. Community health workers are very effective in doing that, but that costs. So how do we cover the cost of finding these people and helping them?
Now, you have a patient network. Is that one of the things that, talk to us about your patient network.
Well, that's one of the projects
Right.
that we are working on now. We have gotten a HRSA grant to help us with that, but that is just so
tedious, isn't it?
small.
Right.
It's a lot of work,
Yeah,
to find people who really are lost to care, and it's like coordinating. And I think of what is happening with a lot of the young people is they're graduating from high school at 18, they're thinking of going on to college and moving away, and then they are transitioning from pediatric into adult care. It becomes overwhelming, especially when they are coming from a nurturing environment where you have the pediatricians that are always looking out for them, and their moms.
We can think of that
really good
rapper a
care.
couple years ago, Prodigy. Now, he may not have died of the crisis, but
Complications
but he got into
related
the
to-
hospital, complications. So that's a perfect, but he was in his 40s, I think. I don't remember how old he was.
Know how old
but
he
whatever
was.
it was,
But he was young now.
Right, he would
I think
be
he was
in
like
that
20, in his 20s.
Right. He would
Yeah.
be in that population of folks that
Yes.
really just want to live their lives and maybe forget that they have the disease. Now, go ahead.
But you see, sometimes I was talking to one young lady, and just something similar, which I learned from my personal experience. I had gone out with my husband for, I think it was our 15th wedding anniversary, and I learned from that point should not touch alcohol.
Really? So that's something you should do?
Because he asked me to sip something to taste it, what he was drinking. And I just tasted it. The night I went to bed, I was dreaming that I was trying to climb over a fence and I couldn't lift my leg. And then I was trying to throw the ball and I couldn't move my arms. I woke up the morning and I was in pain, both in my leg and my arm. So the subconscious was
Telling you things.
telling
Right,
me
right.
that I was in pain. And I tried it again, just to be sure. It happened again.
So you knew no alcohol for you.
No alcohol for me.
Right.
But in talking to some young people, they drink it, they get sick, but this is what their friends do. So I say to them, if they're really your friends,
Right.
and you explain to them that when I drink this, this is what happens. If they're really your friends, they're going to support you and tell you, make sure you. I became the queen of virgin drinks.
Why not? Why not?
I'm having my drink just like anyone else, but it's a virgin drink.
Now, are there any alternative modalities out there to help people with pain? Because that seems like that's one of the things that really impacts the quality of life.
Okay.
Is there anything beside, I was going to mention, I'll leave it there. Are there any? Don't want to talk about illegal substances in New York State, but in other places maybe not. But how you talked about visualization and how that kind of got you through.
Right, and relaxation techniques.
Yes.
And we
Yoga.
sometimes teach
Yoga.
We used to teach our children we still teach our kids how to do deep breathing. The one thing I want to be sure is said here, and I think that's like so paramount and so important, and something that all of us feel very strongly about is many of these patients end up needing narcotics for their pain. So what happens is when they become young adults and they go to the emergency room, and that's when, remember Donette and Dr. Bates mentioned transition. They transition to the adult emergency room, and they go in there and they are in terrible pain. They get their medication and they go home and they come back the next day, and there are people who look at them and say, hey, wait a minute, you were here yesterday. So this whole business of being looked upon as a drug seeker is the biggest travesty in sickle cell disease, if you
Right.
ask any of us. It bothers us. All these patients should be in comprehensive care.
Absolutely.
They should have care managers, case managers looking out for them. They should have a number to call. All my patients, for the all the pediatric patients have my beeper direct number. I would call them back in the middle of the night if they
Yes.
paged me. Because that was, the sense was that you have your arms around them.
Right.
So when they become adults, sometimes partly because, they want to be independent, they don't want this, they feel that, like you said,
Right.
invincible. But I feel like when they go to go to emergency rooms, it's not all emergency rooms will give them that same level of understanding. So it's
Or may
very
understand
important.
it, might
They
not
may
even be
understand,
prepped
right.
for that.
There are a lot of,
And there's
we need more adult providers, to be frank. I mean, we have excellent pediatricians who take care of the children very well, but in terms of the number of doctors or even NPs, physicians assistants, who take care of adult patients, it's lacking. So education, not only of patients, but we need education of the general medical community to really, help them to understand more about the disease.
And so they can
yes,
provide better care.
Yes.
Unfortunately, that's all the time we have, but this was excellent. I think our viewers are going to get so much out of this conversation. So I want to thank you, Donette, and Dr. Batista, and Dr. Viss. And we will see you next time on Brooklyn Savvy.